I was reading a newspaper and I came across a sentence that said, there is an epidemic of flu. Epidemic? What do you mean by epidemic? Well, it is nothing but a widespread or a disease that is happening to a lot of people at the same given time. Yes, we come across a lot of medical expressions, medical terminologies, and we often get confused as to what does this mean. Or sometimes you visit your doctor and he uses certain words, basic medical words, but you kind of get confused and you really don't know what point he is trying to make. So in today's lesson, we are going to learn about few expressions or terminologies that you use pertaining to diseases or illness. Well, the first one is acute. Now, what do you mean by acute? Supposing I have pain in my left arm, okay, and it comes for some time during the day, my arm hurts, it's intense, okay, and it goes away probably with a painkiller or with just applying some ointment, but it's not been there for a very long time, say maybe 2 or 3 days. So when I go to the doctor, I'm going to tell him I have acute pain in my left arm. That means it's for a short period of time, it is intense. So when you have pain that is for a short period and it could be pretty intense, it comes quickly, and we say it is acute. The medical term used is I have acute pain. Now, there are people who have headaches, okay, so it comes for a short period and it is pretty intense, then they could tell the doctor, I have this acute headache and it really disturbs me while I'm working. That means it's a short period but intense pain. Now, likewise, we have chronic, which is exactly the opposite of acute. So something that has been going on for a long period of time or has been happening for a long time, you call it chronic. So if you have been suffering from a disease for a long period of time, you say it is chronic. So now imagine I've been working out at the gym for a very long time and I've developed this backache and it's pretty unbearable. So when I go to the doctor, it's been there for a long time, but I have kind of overlooked it and not really done something about it. When I go to the doctor, I'm going to tell him, I have this chronic backache, okay. That means he will understand that, I've been suffering from this backache for a very long time. Okay. So, well, depending on whether it's short or long term, you use the words acute and chronic. Now, the next one is congenital. Congenital is a condition, it could be an illness or a disease that you have from birth. It's inborn, it's innate. Now, one of the most common congenital medical conditions that you find is the hole in the heart. A lot of children, unfortunately, are born with a hole in their heart. And as they grow and the doctor examines, and when they want to tell the parents that this hole has been there since birth, they use the word congenital, okay. So when a doctor says congenital, it means that the disease, or it could be, an ailment or anything, like for example, the hole in the heart has been there since the birth of the child, yeah. So that is the time you use the term congenital. All right, friends. So be aware, and now you know what congenital means. The next one is degenerative. Now, degenerative means something that advances. Yeah. Take for example cancer. If someone is detected with cancer at the 3rd or 4th stage and the doctor feels there is no turning back, it is irreversible and probably it's just too late to treat it, they use the word degenerative. that the condition, the disease just gets worse, it advances. So when he says it's a degenerative disease, what he tries to tell you is it is going to get worse with time. Well, so I have a friend of mine and her uncle is suffering from cancer, and well, she was pretty low yesterday because after the checkup and the entire examination, the doctor said that he is suffering from, the cancer is degenerative. That means it's just going to get worse. Okay. Now, the next one is epidemic. So, we do have these periods where you have, say for example, the most common fever that was, or disease rather, was the dengue. Some call it dengue, some call it dengue. The bite by the mosquito that leads to fever and it weakens you, and in many cases it has led to death. So dengue is epidemic, flu is epidemic, or there is an epidemic flu. Now epidemic means a disease that is widespread and is happening to a lot of people at the same time. Yeah, so there was this time when we had dengue or dengue, however you pronounce it, it was epidemic because a lot of people were suffering from dengue at the same time. So when a disease is rampant, it's widespread and a lot of people suffer, we say it's epidemic, right? So for example, even flu. So if you go to a doctor and he examines you and he says, oh, you've got flu, nothing to worry about, it's epidemic right now. That means a lot of people are suffering. It's like an outbreak. Well, the next one is terminal. Now, terminal means a disease that is going to lead to death. Yeah, it's going to terminate your life. It's going to end your life. Now, sometimes doctors don't want to be very blunt and say, oh, he's going to die, or, there's no way out. So they use the word terminal. So if he says that, say for example, if he says John is suffering from something that is going to take his life or cost his life, he will say John has a terminal illness. Now, a terminal illness means that it is going to terminate your life at some point of time. That means it is not curable probably, or maybe they can do very little to help, keep the person alive as long as they can by way of medicines or a surgery, whatever works. But at the end of the day, what the doctor is trying to tell you that there is not much they can do. Now that could be because the disease has advanced to that stage, or probably you've got it too late. So when someone says, or when a doctor tells you that this disease is terminal or this illness is terminal, that means it is going to cost you your life. Okay, friends, so remember, these are the few medical terms that you should be well acquainted with. The next one is refractory. Now, supposing you are suffering from a disease and you have started medication, and if it's a long-term medication, like say about 6 months, like for example tuberculosis, TB, you have medication for 6 months, and you kind of go for your regular checkups, your x-rays, your doctor kind of sees how well the medicine is working, and sometimes they feel the medicine isn't working. There is no improvement in your health condition, and then they say if the disease is refractory, that means it is resisting the drugs, and basically the drugs are not working on you. So if a disease is refractory, well, it could be something to worry about, because that means the medicines are not working. Yes, friends, so when the doctor says, even after 3 months of medication, the disease seems refractory, that means the medicines are actually not helping. There is no improvement in the health condition despite the medication. Yes, now we have first, second, you have third degree. Now this is basically used for burn. So if you get a burn, okay, so you have a first degree burn, that means a very normal burn which could be just taken care of with the help of first aid. Second degree burn is something that is not as, it's a little more advanced than the first degree burn, okay, and you definitely need medical help. And the third degree burn is something that is very intense and requires a lot of medical help. It could even mean surgery. So when you say first degree, second degree, or a third degree burn, it means they kind of classify the intensity of the burn. Okay, so just for example, you get burned at home and it's not that bad, but you want to seek medical help. Your doctor tells you, don't worry, it's just a first degree burn. That means it just needs a little treatment and you'll be fine. If he says it's a second degree burn, then it needs more time to heal and needs more care. And third degree definitely could mean really intense and could require surgery. So watch out and pay attention to what the doctor says to exactly know what degree burn you have. All right? Okay, now we have a word saying invasive. Now, if an illness invasive, that means it can spread. It can spread to your entire body. It can spread. So, when the doctor says that this illness is invasive, that means it can spread throughout your body. Yeah, and that is a little scary. So, it means it will invade into your other parts or in other organs of the body, and that means you're in deeper trouble. But if he says non-invasive, that means it will not spread to other parts of the body or the other organs. So this is how they say, they use words instead of spread and will not spread, they use the word invasive, and on non-invasive in case the illness will not spread. Okay. So for example, if you have a rash, you have a skin rash, and the doctor feels it will not spread, he will say it's a non-invasive rash, you needn't worry, I will treat it, I will treat it accordingly. And if it's invasive, he'll tell you this is invasive and you need to take more care of it, right? So friends, these are the basic medical terminologies that you must know. Well, I hope you don't have to speak about it very often and all your friends and family are hale and hearty. Nonetheless, if you have to, or when you visit a doctor, when you kind of read medical reports or you read newspapers, you will come across these words, and I'm sure now you will know what they mean. I hope you enjoyed watching this lesson. I'll be back soon with a new lesson. Till then, take care and bye.